Hi, my name is Paige Land, and today with me I have Penny, who's a 68-year-old female who is recovering from a left total knee replacement, and this happened 3 weeks ago. She's been having home help come to her, and she also has a TENS unit at home that she is using for symptom modulation. So her pain, she's using it to modulate that pain. She says that she has minimal pain at rest, but she does have difficulty lifting her left leg into bed and using it to stand up from her chair. She does use a walker as an assistive device, and she feels like she can't trust her left knee still, and also her muscles in her leg. So she feels like it's going to buckle on her. So one of the tests that we did is that she has some difficulty generating an active quad contraction. So today our goal is to really address that impairment in her muscle function of the quad. So we're going to target this by using the NMES, which is for muscle strengthening. So for muscle strengthening, we're going to target this quad group and focus on that muscle performance. My rationale for using this is we are activating those large nerve fibers so that we don't have atrophy in that muscle. And this will also just give her a little bit of a push to help her contract since she's having so much trouble with it. All right, so I'm going to go ahead and introduce myself to the patient so we can get started with the treatment. All right. Hi, Penny. How are you doing?
Good. How are you?
Good. So my name is Paige, and I'm a student PT. And today I hear that you come in because you're having some trouble generating some contraction in this left quad. And so we want to help with that. And also hear that you just had your knee replaced, total knee replacement just about 3 weeks ago. So you're still recovering from that. And I hear that you're having some difficulty just really doing some activities in your life, such as just getting in bed and standing up from your chair. So we really want to focus on that and try to address that with you so that we can help you get some more muscle function so you're able to have an easier time doing these activities. So I just want to ask you a couple questions to make sure that you're safe to do this. Do you have any apprehension toward electricity?
No.
All right. Do you have any blood clots in your legs or anywhere in your body?
No.
Do you have any wounds I should be aware of that are open, any scars? All right. Are you pregnant or trying to be pregnant? And do you have a pacemaker?
No.
All right. Do you have any questions so far?
I don't think so.
All right. So, I just want to also just get consent from you that I'm able to touch you and move you around on the table and maybe hook you up and get you set up with some electrodes to help that muscle contract. So, I am going to go ahead and position you on the table so that we can get you set up.
And then you can go ahead.
Lay back on your back, you can center your head.
Alright, so
We are going to make your legs comfortable.
alright, you feel good? Alright.
Alright.
Does
that feel okay? Comfortable? Alright.
Any weird feelings in that area, please let me know.
So, at this point in the, before we have the patient lay down for their treatment, we would take a pre-test. So for this person's pre-test, we would take a manual muscle test of that left quad, just to see how much muscle contraction she has and see how much ability she has in that muscle. We may also look at her gait pattern depending on if she's using that walker still as an assisted device, just to see how much she's compensating so that we know what our pre-range is before we get to our target range. All right, so I'm going to go ahead and get my patient set up on the machine, and I'll be back to talk about the parameters. All right, so Penny, we are going to set you up on this NMES unit, which is going to create a muscle contraction here in your quad. So what you probably will feel at first is this, the gel from this electrode is going to feel a little cold on your skin, but we're going to it's going to adapt over time. So we're going to identify this muscle group right here on your leg. Place it here.
I think it was just this one. Oh, there it is.
All right. So for this patient, we are going to have parameters that are for NMES, which are going to be for muscle strengthening. So for this patient, we are going to be focusing on having a on and off time of 10 seconds on, 50 seconds off, which is gonna give the muscle a lot more time to relax after it has its contraction. So for our pulse frequency, we're gonna have it at 30, and we know that the range is typically between 35 and 80. So on this device, we have it at 30. And then for our ramps, we know it can be between 2 and 5, and we're gonna have it at 3. For our on time, we said we were gonna do 10 seconds. And for our off time, we said we were gonna do 50 seconds. But for this machine, it goes up to 45, so we're gonna do 45 and 9 just to accommodate that difference. All right, so I'm gonna go ahead and hook the patient up. The patient will do this for about 20 minutes. So the longer your relaxation time, the longer time you want to have it on the patient. That way they're getting the most out of this treatment. All right, how are you feeling? Good. You have any questions? All right. So we're going to go ahead and get started with our patient. So I am going to start increasing the intensity, and you're going to feel some tingling. So when you feel that tingling, please let me know. If it feels uncomfortable at all, please stop me and let me know. All right, so we have it on. So you should start feeling tingling soon.
So, I mean, I guess anyone could,
All right, so got it tingling. So we're gonna go until we see a muscle contraction.
His lumbar spine and his hip checked out okay with testing. He does stay standing on
So we're at our muscle contraction. So we're gonna change our rest time to 45. And so for this, you're going to extend your knee with that contraction. Okay, so you're gonna do it the best you can. I know it's pain. If it's painful, just say it's painful and let me know, but do the best you can with that. Just extend your knee out and hold with that contraction so you can generate that and feel that.
oh, that's really short.
That's good.
Hopefully that's okay.
Yeah, I think it's fine.
Okay, maybe I need to slow down.
Just be comfortable, whatever you're comfortable, whatever your pace is. I think you're doing good.
The goal that we are trying to reach today.
Still feeling okay? Just resting.
68-year-old that had a left totally arthroplasty.
While I'm assessing the skin, I don't see it having any adverse responses right now, so she should just feel normal tingling. And now she's in her contraction, so we can palpate and feel that, and she's gonna extend out with it.
She's had some atrophy in her disuse, so will help.
All right, so for the purposes of this, since her contraction ended, we are going to end this treatment,
I'll be your certificate teacher today. So I just have a couple questions for you.
and we are going to get this off of the patient and reassess this area.
Do you have any history of blood clots?
Do you have any questions?
And then
No, I don't think so. All right, so I'm gonna get these off and check her skin out.
Are you a little nervous about it?
Everything looks okay on that one.
Perfect. So we'll just go ahead and explain what I'm gonna do. So I'm gonna have two electrodes on you. They're gonna be on your thighs.
All right.
And basically.
So at this point, we would have the patient just try to get her back up on her feet, and then we would do a post test. So as I talked about with the pre-test, we would do a manual muscle test on this left quad, and we would see if she has any more function in it, just to see how she's feeling. We would also check her gait out and see if she's maybe able to put more pressure and feel a little bit more comfortable trusting that left quad. And we may also get just a pain rating from her, like we did in the beginning, just so we can make sure she is not feeling any more pain than when she came in.
So I have some soap.
All right. Also, last thing, just for assessing any adverse response, if this patient was to feel any adverse response after, we would really want to look at the parameters we use with this patient and maybe change the parameters on it, or even pick a different modality. If the patient feels anything when they leave, we may want to have them call us and let us know how they're feeling so that we can address that. But I think that is all for this patient. Thank you.